Welcome to January PRS. I hope you're staying warm. At the end of this year, we mark the 10th anniversary of the first partial face transplant. Even though the procedure is barely a decade old, all of us in plastic and reconstructive surgery are actively working on improving and evolving this innovative procedure to the next frontier, trying to push our surgical limits, increase the cost effectiveness and sustainability, and grow our ability to heal even the most extremely injured patients. Regaining the ability to even blink greatly improves face transplants recipients' ability to see properly. Using ocular exams, visual acuity tests, photos, videos, these authors in this article chronicled one face transplant patient's functioning before the first operation to after his last revisional surgery. By 8 months following his last surgery, this patient had regained 100% control over voluntary blinking in both eyes. Involuntary blinking had improved about 70% in the right eye and 100% in the left. The fact that we're now researching blinking outcomes in these patients when face transplantation seemed more science fiction than science even a decade ago shows how dedicated and sophisticated plastic and reconstructive surgery has come all around the globe in developing and refining this amazing, life-changing technique. Despite these incredible advances in this discipline, some academics fear that face transplantation may cost too much to be accessible to significant numbers of patients. The next study investigated if face transplantation can and will be cost-effective. They compared medical bills, and this team calculated the differing one-year costs of conventional head and neck reconstruction versus full-face allograft transplantation. Face transplantations cost about $337,000, which were significantly higher than conventional reconstruction, which averaged about $70,000. This is a giant gap in cost, but the researchers point out that once adjustments for severity of the injuries were made and factored in, the costs were truly much closer. They also noted that face transplantation is still a very early technology, early adopter phase, and that its efficiency and cost will definitely decrease over time. These authors drew our attention to these unmeasured functionality and the quality of life benefits that truly may positively influence the cost-benefit ratio for face allograft transplantation procedures. I think, as with all new innovations in technology, we are at the very early embryonic stages of this technique and technology. It will evolve so much and so rapidly because it is truly combining the best of what we can do surgically with now what we're doing immunocompetently, because it's truly emerging of medicine and science. Just because we do it doesn't mean that we should. And just because we are doing it doesn't mean that we can continue to do it unless we can truly break the immunologic shield that actually our human body has that automatically rejects this tissue. That will be determinant of whether it's going to be successful long-term or not. Well, articles like these are truly stepping stones on the pathway to building a true bridge to new and better innovation and technology in helping to make humans improve their quality of life and to restore them back to normal, which in many of these patients could never have been done before using conventional techniques and technology. So it is truly another epiphany or a tipping point in plastic surgery, which will take us to all kinds of other areas that will be very, very fruitful and beneficial to all of our patients. So stay up to date with face transplantation news and all the other cutting-edge areas in plastic surgery. Prescribe and stay tuned to plastic and reconstructive surgery.